Okay. So let me begin again by reading that disclaimer. SwarnaGuard is not a medical device. It does not treat or cure any disease or illness. Rather, it assists the body in decreasing toxin loads and restoring self-regulation, thereby letting the body recover itself. Now, I want to go over here to products. We have added a couple of things. You can purchase the booklet that shows all of the complexes and then all of the programs within each complex. And you can purchase that directly from the products page. Now, I understand that some people have been getting an error signal when they use SwarnaUSA.com. If that happens to you, BOBHUTT.com. I just posted a really interesting testimonial about our 26-year-old granddaughter. She was scheduled for surgery, and the surgeon did a visit with her the day before the surgery. She was not feeling well, so they did a COVID test, and it tested positive. And so we had her run complex number 7 and number 9. And she did that for 3 days and was completely well and had a negative COVID test. She was able to participate in a Mother's Day celebration. So that was really awesome. All right. The next thing that we're going to do tonight is we're going to take a look at all of these complexes. Those of you who have machines have received this little sheet when you got your device, and it shows all of the complexes. But one of the problems with that is that there's a lot of it is in medical language. And so lots of times people don't know what it is. So I'm going to go through this. I've added a brief description of what that program does. So let's start here. Most of these are pretty self-explanatory, but the super program is one that you can use when you have physical symptoms and you don't know what the cause is. This one, adnexitis, that's pain and inflammation in the ovaries and tubes. Allergic rhinitis, seasonal allergy. Angina attack, that's chest pain related to the lack of blood flow to the arteries in your heart. If you have something like that, you might be experiencing a heart attack. Angina arrhythmia, that's chest pain with a very rapid heart rate or skipping beats. Arteriosclerosis or atherosclerosis, that's plaque buildup in your arteries. So if there's any family history of early heart attack, it's really a good idea to run this program. The next one, Ascarius, is roundworms. It's parasite. So if you want to do a parasite cleanse, you could run this because it works on other parasites as well as roundworms. Biliary dyskinesis, that's a malfunctioning gallbladder. And one of the symptoms is fatty food intolerance. So if you eat bacon and you get a pain up under your right rib cage or in your shoulder blade, that's a gallbladder issue. Cholecystitis, that's an acute gallbladder infection. Coccyx trauma, coccyx refers to the tailbone, so tailbone injury. Common cold virus is Coxsackie. You know, if you didn't know the medical language, you might not understand that. Cosmetology for men and women, it improves skin and prevents hair loss. Now, if you have that little booklet or you open it online from the website, you can see a fairly lengthy discussion of what this one does. Cystitis, that's a bladder infection, painful urination. Cytomegalovirus, often abbreviated CMV. Almost everybody has had cytomegalovirus in their system, and it usually really doesn't cause any symptoms. This one is helpful for mite infection. Dimidex is a mite that can get in the skin and give you a very itchy rash. The dental program, good for gum disease, frequent tooth infections. It helps prevent cavities. Detox from radionuclides. That's from excessive X-rays or radiation therapy. If you haven't had a lot of X-rays, you really don't need that. But if you've had cancer and radiation therapy, this would be a really good detox program to run. Diabetes, that's adult onset diabetes. Digestive system restoration, that's irritable bowel syndrome, colitis, gastroesophageal reflux disease, that's GERD, ulcers, stomach ulcers, peptic ulcers, dysmenorrhea, painful menstruation, premenstrual syndrome. The ear and hearing impaired complex is good for tinnitus. Otitis media, that's an ear infection or ear pain. And I don't even know how to say these words. Liver tumor, that's uncommon in the US. So that's probably something that could be deleted from this list. Endometriosis, painful menstrual cycles, energy restoration. This is to run if you're really fatigued. So if you have a little middle of the day fatigue, you can just run this and you should get energized. Epstein-Barr virus, that's what causes mono, chronic mono or acute mononucleosis. Hyperopia, that's far-sighted, so it's hard to see close objects. And nearsighted is hard to see distance objects. Now, people that wear bifocals, they actually could run both of these programs. The flight program is for anxiety of flying and also good for jet lag. When we flew back from Malaysia and Thailand, we both wore our devices and we did not have any trouble at all with jet lag. Gastritis, upper abdominal pain, worse after eating, also a bloated feeling. Colitis, upper and lower abdominal pain. Colitis is an inflammation of the bowel. Good student, people with learning disabilities, both adults and children. Good for ADD and ADHD. Hair loss and dry skin for women, especially hair loss in women in menopause. Headache, migraine, tension headaches, people that have neck issues that cause headaches. Herpes simplex 1 is cold sores and canker sores. Herpes simplex 2 is genital herpes. Herpes zoster is shingles. And then hypertension basic and intracranial, high blood pressure, and this one is for very high blood pressure. And some people have trouble with low blood pressure, so that's called hypotension. Insomnia, unable to get to sleep or unable to stay asleep all night. Kidney support, this is good for people with kidney failure. And if you've had a blood test from your doctor where you have a low eGFR, GFR means glomerular filtration rate. It's supposed to be above 60. If you got 40 or 30, this would be a really good program to run. This one is for a parasite called Giardia. It's also called beaver fever. And sometimes people get this when they go up in the mountains and they drink out of a spring. And if there are beaver around, the beaver have this, and deer also have this in their digestive tract, and you can get it from contaminated water. It has been helpful in people that have Parkinson's, but it's also good for learning issues. So focus and swollen tender lymph glands, that's lymphadenitis. Mastitis, that's a breast infection, mostly after childbirth or women who are breastfeeding. Mastopathy, that's painful fibrocystic breast disease. Some of the milk ducts will get plugged up and create little very tender cysts. Memory correction, good for forgetfulness. Menopause, hot flashes, night sweats, night anxiety, insomnia, migraine headaches. Onychomycosis, that stands for finger and nail infection. Nasopharyngitis, sore throat, any kind of neck pain, so neck myositis. Myositis refers to muscle, so any kind of muscle pain in the neck. Nervous system regulation, numbness, tingling, weakness, but also anxiety and depression, and neuropathy. So people with diabetes often get neuropathy, or people who've had chemotherapy often also have neuropathy. nervous tick. So this is a situation where there's a involuntary muscle movement. We had a niece who had quite a severe tick associated with taking an antidepressant medicine, and we loaned her our machine, and it was very helpful. Follicular ovarian cysts. These are little cysts that form on the ovaries, and they can be very painful, especially mid-cycle when ovulation occurs. Pancreatitis, upper abdominal pain, mostly in the back, but it's relieved by leaning forward. This is a medical condition that really needs to be addressed. So if you feel like you have pancreatitis, you certainly can use the machine, but you might also want to check with your doctor. HPV, papillomavirus, this is genital warts, or also called venereal warts. Phimosis, that's a foreskin issue in uncircumcised men. Photodermatitis, rashes aggravated by the sun. Some people call it sun poisoning. Pinworms. Also, if there's any parasite issues, just run this program as well as the Giardia program. Postherpetic neuralgia. This is pain following shingles or genital herpes. Post-surgery period, recovery after surgery, and anesthesia. Potency enhancement. This is for men specifically, erectile dysfunction, premenstrual syndrome, pelvic pain, headache, moodiness prior to the onset of menstruation. Prostatitis, an infection in the prostate, it may show an elevated PSA if there's an infection. Psoriasis and also psoriatic arthritis. So people that have psoriasis sometimes get joint pain, and that would be good for this. Rheumatoid arthritis, polyarthritis, that's pain in multiple joints, and sometimes it's migrating pain, which means it moves around. Keloids, these are people that have an excessive scar development, any little scratch. I've seen people that had their ears pierced, get these giant scars. So that would be very helpful. Scarlet fever is a red rash that comes after a strep infection. Radiculitis is nerve pain down the legs. It comes from a pinched nerve. This would also be good for carpal tunnel syndrome. Shoulder pain recovery, rotator cuff injury, impingement syndrome, frozen shoulder, anything going on with the shoulder. Sinusitis, sinus infection, and if you think you have that, you might also run the program allergic rhinitis. Smoking cessation, snoring correction, spinal pain, so any kind of neck, low back, mid back pain. Stomach flu refers to vomiting. So if you have, in medicine, we call it gastroenteritis, but a lot of people call it stomach flu. Stomatitis, canker sores inside the mouth, but it can also be used for children with hand, foot, and mouth disease. It's a viral infection. They get blisters on their palms, on the bottoms of their feet, and in their mouth. Stomatitis, angular cheilitis, that's cracks in the corners of the mouth. So there's two kinds of strokes, a hemorrhagic stroke, that's bleeding in the brain, and a stroke from a blood clot. It's called an ischemic stroke. Tennis elbow is a type of tendonitis. It's often associated with repetitive motion in the arms. But if there's any kind of tendonitis or plantar fasciitis diagnosed, you should try this program. Hashimoto's thyroiditis, that's a autoimmune disorder of the thyroid. You can also use this if you have hypo or hyperthyroidism, so low thyroid or overactive thyroid. Lymphadenitis, that's a throat infection with tender swollen glands in the neck. Hematoma, that is bruising and free blood in the muscle or underneath the skin. Usually there's quite a bit of swelling. And when a person has a hematoma, gravity can cause that bruise to migrate downward into the lower parts of the body. Trigeminal neuralgia, that's a nerve pain in the face. It's sharp, shooting pain. It can be in the scalp. It can be in the face. Urethritis, painful urination. Uterine bleeding, that's bleeding in between menstrual cycles or postmenopausal bleeding. And just a comment about that, if you're a woman in menopause and you have vaginal bleeding, you certainly can start using this device, but you have to go see your doctor. Because postmenopausal bleeding can be hormone imbalances, but it can also be a signal of uterine cancer. Uterine fibroids, that would be something that your doctor would have diagnosed. And then vaginosis, that's candida or vaginal yeast infections. It can also be used for Gardnerella for something called BV, which is bacterial vaginosis. Wrinkle reduction, I would also use cosmetology for men or women if you're concerned about your wrinkles. So mode 2, 3, or 4, you have to change the mode if you're going to use these. So activation of vital energy, very good for chronic fatigue, but also good for awakening. Alpha rhythms, use that during meditation, helps you get into a better alpha brainwave state. Alpha for comfort, stress reduction. Alpha for physical strength. You might use that during exercise if you're trying to build muscle. Altered state of consciousness. This would be very good for somebody who has a spiritual practice where they want to get into deep meditative states. Anesthesia can be used to reduce chronic pain. Anxiety reaction, good for stress control or people that have panic attacks or just general social anxiety. Beta rhythm is good for putting the brain into a beta state, and this helps with focus and it helps you to think more logically. Brain frequency balancing, that's to help balance between relaxation and concentration. Cerebral support, this should be used for studying or memorizing. It helps reduce burnout. So if you're really stressed from a job or family situation, this can be really helpful. Children's program, good for children that have behavioral or learning issues. Conscious dreaming, this will actually help stimulate lucid dreaming and really helps with creativity. I used this one night and I put it on repeat, and I had 6 dreams that night and I remembered every one of them in the morning. Conscious control helps for learning how to think, imagine, create, very good for problem solving. Creative development taps into the subconscious for idea generation. And this should be used after you use 165. So let's say you're working on solving some sort of problem at work or in your personal life. You would first use conscious control, which is about a 20-minute program, and then use creative development. Deep relaxation, very good for meditation or relaxation exercises. Delta rhythm, very good for deep sleep. And delta for falling asleep. So this would be for insomnia where you have difficulty getting to sleep. 3 depression programs here. And this one should be used with your eyes open. And then these used with eyes closed. Just one precaution here on depression program 1, should not be used if someone's in a manic phase if they have bipolar disorder. So with bipolar disorder, people can be really depressed for days and days, and then they get in a manic phase and they're super hyper and they have this tremendous clarity. You don't want to use this program during that. You can use this number 2 during the manic phase of the bipolar disorder. This one gives you energy boost in joy and happiness. So if somebody is quite down, this would be a really good program. Energy boost helps if you're overly fatigued. enter drowsiness state before sleep. So if you're having difficulty getting to sleep, you could run the insomnia complex, but you could also run this one. And this helps people wake up. Some people just jump right out of bed in the morning, they're ready to go. And others are very drowsy and want to stay in bed. This would be a good program to run for that kind of situation. And the hypnotherapy suggestion, this would be good for running that while you're reading positive affirmations for yourself. So it's really good for self-hypnosis. Immune boost, that's self-explanatory. Increasing adaptive resources. So this helps you shift your moods. So if you're really down, run the number 165 conscious control first, and then follow that with either one of these or first this one and then that one. Memory support, it's pretty self-explanatory. Also good for studying, and you can run it along with the studying complex, which is 203 and 204. Now, metabolism 1 and 2, this increases your metabolic rate. So this is good for somebody who has weight issues and they're kind of sluggish and they really don't want to be very active. The metabolic rate is how fast your body uses energy. So this would help increase that. This one helps increase muscular strength. Mind clearing helps you become calm and tranquil. Negative thought erasing. Sometimes we get trapped in these thoughts that just roll over and over and over in our head, and sometimes they can be disturbing. This would be very good for that. Neurohumoral regulation. So this is good for anybody with an endocrine disorder. Endocrine system refers to all of your glands. So your pancreas, adrenal glands, thyroid. Some people have been diagnosed with adrenal fatigue. This would be very good for that. It'd also be good for people with MS who have nerve dysfunction. Now, occasional regulation, this would be for somebody that has a lot of anxiety, irritability, fatigue, and especially someone with a short fuse. They get angry very easily. Out of time 1 and 2, good for deep meditation, deep states of prayer, desire to lose the sense of time. So this would be very good if you like to meditate. Overcoming fears, good for phobias. Schumann waves, these are waves that are produced by the earth. And so these are very grounding. So if you're a person that has some difficulty being grounded, this would be helpful. Self-esteem is very helpful for the improvement of that, improvement in your self-talk and your self-image. Sexual regulation, good for loss of libido and sexual drive. It would be good to use 195 if the 194 doesn't seem to be working. Short break is very good for being in a highly stressful situation and you need to calm down and relax. This sleep program, first one, is good for insomnia related to anxiety and restlessness. And then this one is for getting back to sleep. So if you wake up to go to the bathroom and you lay there for a half hour, put this one on. It helps you get back to sleep. The sports program is good for people who are participating in a sporting event to help them be more relaxed before the event. I'm not sure, you could put this in a fanny pack or something like that and actually use it while you're running. Stress programs, these are fairly self-explanatory. This one is good for pains and spasm during stressful situations. This one is associated with hormone disturbances. So if you get really stressed and you're in menopause or premenstrually, this would be really helpful. Study programs help focus and memorization. Super program is when you have physical symptoms but you don't know what the cause is. So we find this one to be really helpful. Theta helps with meditation. This one, theta for awakening. So this is for awakening the subconscious mind to awareness. Theta for inspiration, very good for creativity and problem solving. Good for artists and musicians and anybody who has a problem they want to try to find a solution for. This is very good for that. And then theta for morning freshness, so relaxation in bed for a few minutes before you actually get up. I'm going to stop sharing here. And just a couple of general comments. Just put out a new video, a training video on how to use the device that was sent in an email. And I would encourage everybody to use that, especially new people who are going to be getting their devices soon should use that to understand how to use it. Oh, I did mention some people having difficulty getting an error message when they go to SwarnaUSA.com. If that happens, then just use bobhutt.com. The original website was named bobhutt.com, and then we added the domain SwarnaUSA and pointed that at bobhutt.com, and it's supposed to automatically switch, but sometimes it doesn't do that. All right, I'm going to open this up to anybody who has any questions or testimonials. You have to unmute yourself.
I have a question, Bob.
Yes.
Do you know how the frequencies are generated in this?
Well, the frequencies are generated by antenna that are in the device. So if you look at your machine, you see these little hands on the back. So the two little hands there, that's where the antenna are. And that's why they recommend that you have the back of the device toward you, or if you have it on your desk, that you have the back of the device toward you. Technically, how they are generated, I do not have that information.
Could be digital or maybe crystal in it?
I doubt that it's a crystal. These are all electronic. They don't use crystals much anymore, even in radios. Since the invention of transistors and modern electronics, they don't use crystals very much anymore.
I think that's what the original Rife machine used, was crystal.
Probably did, because back then they didn't have the transistors and diodes that they have today.
Okay, so you don't know about the digital part then?
I do not. I can find out.
Okay, that would be wonderful.
There's an expert in Malaysia that knows a lot about bioresonance, so I will find out about how the frequencies are generated.
Also, a couple frequencies I'm wondering, will this get rid of heavy metals in your body?
Yes, those are the detox programs, and it's really important to use those for the first couple, 2 or 3 weeks, and then a couple times a week, you want to run the detox programs. What happens is any kind of toxins, heavy metals that your body has difficulty getting rid of, they all have a charge on them. And if you can change the charge, then it's easier for your body to eliminate them through your kidneys and through your liver. And so what the bioresonance does is it helps modify that charge so it can be eliminated through the body. It's the same mechanism that's used in some of the foot detox baths. I'm not sure if you're familiar with those.
Yes.
Anything that can modify those charges helps the body to eliminate those things.
And what about Morgellons?
Morgellons is you're talking about Morgellons disease, so to speak?
Yes.
Yeah, so the medical communities don't even believe that exists.
I know.
They write it off as a psychosomatic illness. I think it would be really helpful for that. And if you want to email me, I can talk to you about specific programs to use. People that have Morgellons have a feeling of things coming out through their skin. And there are some programs that could be really helpful for that.
Yes, it looks like fibers coming out. I know several people that have had and do have that. And then they get sores all over them too.
It probably is toxic material that's coming out. So the detox programs for sure would be beneficial. An additional comment about the detox program, you have to be a little careful with those. And I would recommend just running one cycle on the nighttime detox and then one cycle on the daytime detox. What can happen if you do too much? You can get what's called a Herxheimer reaction, and it can intensify your symptoms for a few days. Before I understood that, I did the daytime detox on a repeat, and I did it for the whole day. And I was so achy and fatigued, and I didn't understand it until someone discussed that with me, that was over detoxification. You can overload the amount of toxic material that your body has to get rid of. And if it doesn't get rid of it fast enough, then you get this reaction. So I would encourage you to do the detox regularly, but just one cycle per night and one cycle per day. Then after you do that detox cycle during the day, then you can run other programs that you're interested in running.
One more question. This device has 210 frequencies, correct?
Yes, the ones that you're going to be getting, and the 34 that we have brought to the U.S. also have the cancer programs, and the ones that are coming up will have a weight loss comp.
Now, what about the other ones that we can download from the computer? Do you happen to have a list of those too?
Well, there's a software program that you basically download, and then you can create your own complex. I've tried to do it. It's not very easy. If you would like that software, just email me and I'll be happy to send it to you. If you're tech savvy at all, you could probably build that. I just haven't taken the time to do that.
Okay, thank you.
Supposedly in June, there's going to be access to a bunch of complexes that we can download from the cloud. I don't have any details on that. That was just something that was said from one of the people in Malaysia.
Okay.
These are really good questions. Thank you. Anybody else have questions?
Yes. Hi, it's Michelle. Good evening. So my question is two questions. Does the time frame vary in noticing any kind of improvement according to the selected complexes? Say, yes. For example,
the more acute symptoms disappear much more quickly, whereas chronic things take more time. So if you say you injure your knee and you have a lot of knee pain, we've seen people get totally rid of that in just a day or two. But if you have diabetes or you have Parkinson's or you have hypertension, then you're going to have to work at that a little more. And that could take a longer time. One of my mentors always said, for people that have chronic conditions, it takes 1 month for every year that you've had that condition. Now, I think that this device will work much faster than that, but I don't know that for sure, but I have seen that. We have several people with diabetes, and after 6 weeks or so, they're seeing considerable improvement. But first week, nothing seemed to happen. Does that make sense?
Sure. Yes, thank you. My second question is, it's not a question actually. It's just a little testimony.
Oh, good.
And in regards to the detox app, I was taking some medications, which one of the side effects, it affected the liver enzymes. of course, we know the liver is one of the detox organs.
Sure.
And yeah, and I've noticed on 2 occasions when I had a blood work done, the liver enzymes significantly, specific ones which were concerning, where they were decreased up until yesterday.
Yes, that's excellent.
Right. So that's,
so
yeah.
that means that
Thank you. That's
that your liver is working better. It's clearing those things better. When your enzymes are elevated, that means that you're not clearing those enzymes through your system. Everything in the liver is like a toxic waste factory, and it breaks things down. And if it gets kind of clogged up, then those enzymes will back up into your blood and they will be elevated. So what you're noticing is improvement in your liver function.
right. Thank you. And the time frame was approximately, I would say, 1 month since the time that I received this one.
Excellent.
Thank you.
Any other questions?
Mom, I have a question.
Okay.
It's me, Janet Roman. I just wondered, is there a quick way to get to, let's say, number 60 without going through all of the numbers?
Yes, if you just hold the down button, it will cycle rapidly. And if you're, let's say you're going to 150, you hold the up button and it will cycle rapidly. Let me demonstrate that for you. That is on the training video. So if you, let's say, it's cycling through very rapidly. See that? It's not not real clear. There we go.
No, it's not real clear, but you can see it flipping through.
So you know, if you push it one at a time, but if you hold it down, then it speeds through them.
Okay, thank you.
And if you watch the training video that was on one of those emails, you can see that really clearly.
Hey, Bob.
Okay, thank you. I'll go back and review.
Yep.
Bob, I know you mentioned that you can double up the program and do it twice in a row, and I know you showed me that, but is it in the book somewhere, or can you tell me that again?
It's on the training video. So let's say, again, I can't show you this scan, and if I push the right-facing arrow, you get a little R. Can you see that little R in there?
Okay.
And then that will run that program repeated. If you push it twice, the little R jumps up to the complex. And so it'll run that complex repeatedly until you push the left-facing arrow, and then that'll stop it.
Okay.
But just watch the training video. Did you get that email?
I think I tried to open it. It didn't work. I emailed you about it. I couldn't open it.
Well, just send me an email and I can send that to you directly.
Okay. I'll try on a different device.
Any other questions or testimonials? We've been using ours since the latter part of February, and I got to say, I feel better than I've felt in a long time. I don't generally have any health issues, but energy and clarity, some memory improvement. Any other questions? I'm going to post that list that I went through tonight. I thought it would be a good idea to actually go through it on the video, but I will send that to everybody in an email because the medical words sometimes make it a little difficult to determine which programs to use. And if you get the 30-page booklet, this one, it has a description of all of the complexes, and then it lists all of the programs that are running. So it shows the complex, the description of what people are using it for, and then it gives a list of all the programs, and you can also see all of the frequencies that are within each program. And again, that is described on the training video.
Any issues or explanation that we have to have if we're traveling on an airplane with one?
No, just hang it around your neck. Don't say anything to anybody. It's not an issue. The battery is not it's only a small 5 milliamp battery, and it's not going to catch on fire. It's actually safer than your cell phone. We used it flying and had very good results. All right. Anybody else have anything? All right. The big question in everybody's mind who doesn't have a device yet is, when are we going to get these things? The latest is that I'm supposed to be getting a list of serial numbers and pins this coming week. And what will happen is, once you've paid your full amount, the $700, we will send you a pin and instructions how to get into the Swarna website back office. And then you use that pin to open an order form, and then you order it directly. And you might, I don't know exactly how that's going to work, but you might want to get with your sponsor, because the placement in the hierarchy is going to be determined on that order form. The other part of the order form is going to ask for your bank information. So your routing number and account number, and then any bonuses that you would receive for sponsoring somebody will be deposited directly into your bank account. And there's no BV or PV in this system. So the bonus for sponsoring somebody is right around $95, and that goes directly into your bank account. I know some people are a little hesitant to put their banking information on a form like that, but nobody can really access your account if you write that with your routing number. Question: can more than one person use it? When the machine is in your aura, it is affecting your particular situation. So most people's auras are about 2 feet out from their body. And so if you're sitting next to somebody, they would be influenced by that program. We use ours at night. We just lay them next to us in bed, and we are probably being influenced by both because we're laying close together. All right, anything else? I said I would try to keep this to 30 minutes, but I got a little running overtime going through the explanation of those words. All right, if there's no other comments or testimonials, questions, we're going to end this. We're going to do this every 2 weeks. We're going to try to do it on Wednesday. So plan on every other Wednesday at 8 Eastern time. If you're another time zone, you have to figure that out. All right. Well, everybody have a great week, and keep your fingers crossed that we start getting access to these this coming week. Good night.